According to Dr. Hasfa Lukwata from the Ministry of Health, COVID-19 contributed a lot to the implementation of the Tobacco Control Use 2015, whereby the tobacco industries had to follow health guidelines from the Ministry of Health. People limited the number of cigarettes they take a day, among others.
As a tobacco control program, we made some achievements during the COVID period, because during that time our case was in the law. Our tobacco control regulation was actually we were hindered from implementing it. We put an injunction and we could not implement it fully. However, along the way, we found that the industry went ahead to implement as we had told them to implement in our regulations.
Dr. Lukwata revealed this during the launch of a book titled The Big Tobacco Allies at the Minister's Village Hotel in Ntinda. This survey was done as a way of reinforcing the Tobacco Act 2015, and African Tobacco Control Alliance commissioned a survey on the mobilizing of tobacco industry front groups and allies, and it was conducted by Uganda Health Communications Alliance. Among its objectives are to expose tobacco industry intermediaries and mobilize stakeholders to take action against their activities, to identify tobacco industries and entities that sponsor intermediary, and called on government and public intervention to stop them, among others. In their report, several allies of tobacco industry were revealed and the tactics they use, which include using musicians in their music videos, posters, and other ways, and recommended the full implementation of Tobacco Control Act, among others. During the launch of this survey, the chairperson of the Tobacco Control Committee, Boaz Musimenta, said the survey revealed much information to them, especially about the musicians, and they are to sit as soon as possible to forge a way forward.
Who smoke on TV, that is also illegal. The act makes it illegal, and we are going to communicate to the Uganda Communications Commission, who are responsible for films and performances, to take action on the matter. Those are some of the decisions we intend to take during the 9th March meeting, so that the minister can have a basis to act.
Dr. Hasfa also commented on the survey and how useful it is in the control of tobacco.
It was a good thing. We got feedback. People said that those pictures were very scaring, and they could not. They learned that tobacco was very dangerous to their health, and we managed to see people reducing on the intake of tobacco, cigarettes mainly. But also, because of what was happening, I think there were some shortages. Not everyone was able to get to the shop to buy these cigarettes. So those who were taking maybe 20 had to reduce and now begin taking a little more, so that they can keep the little that they had collected, to keep them for a while.
She further highlighted the critical issues in regard to the Tobacco Act.
Partnerships, we're not supposed to receive any gifts from this industry. We're not supposed to be sponsored in any way by the tobacco industry, because it creates a conflict of interest, whereby the officer who has received this gift or whatever, or this benefit, may not be able to implement properly, or may not be able to, to enforce the law against tobacco as it's supposed to be. So it is very necessary that we become transparent, that we minimize as much interaction with the tobacco industry as much as possible, and we also need to if we have to interact with them, it has to be in the open, it has to be transparent as much as possible. But even then, we need to also be able to look out for the information that the industry is giving us. Many times we have been given false information. The industry tends to give false information. So we need to really find out whether the information they're giving us is actually accurate, so that we use it to make any policies against tobacco.
According to Uganda Cancer Institute, over 38 Ugandans die every day due to tobacco-related illnesses, and it costs government 108 8.5 billion Ugandan shillings to treat tobacco-attributed illnesses all over Uganda. Tobacco use is on the rise among the youth and is estimated at 17%, with 11.6% being men and women being at 4.6%. This report has been compiled by Issa Chigongo for Channel 44 Prime News.